Well, let's speak now to Anne Rimoin. She's Professor of Epidemiology in the Fielding School of Public Health at the University of California and joins us now from Los Angeles. Professor Rimoin, thank you very much for making the time for us. We heard Dr. Fauci there saying you don't want to be reckless, you don't want to move too quickly. How do you interpret what he's saying? Are we going to slowly see all restrictions in America disappear?
Well, I think we have to focus on what Dr. Fauci actually said. And what he said was we need to be inching back towards normalcy. And that's really key here. He's not saying we're going to take off all restrictions, that we're just going to go straight back to normal, but that we're going to be in a process of moving forward in the right direction. We still have very high case rates right now. We still have a lot of hospitalizations, 2,000 deaths a day. So we're not there yet, but we can see the light at the end of the tunnel. And that's great news. And we have to start really thinking about what does life look like when we see a real decrease in cases. It means that we're going to have to start thinking about practical ways to pull back, give people the opportunity to enjoy life in a way that has some semblance of normalcy, but be ready to move back if needed, if we start to see another variant or something else comes down the pike.
And that's the problem, isn't it? It's not really possible to give a firm date because, as we've seen over the last 2 years, this virus can be unpredictable.
You're absolutely right. Nobody knows what's going to happen here. All we can do is hope for the best, prepare for the worst, and be ready to pivot as needed. Eventually we're going to have to start moving into the direction of relaxing restrictions because we're going to see cases go down. The risk is going to be lower. At that point, people are going to have to really start thinking about their own risk and thinking, okay, the government is not giving me guidelines here where I'm going to have to follow. So what's important to me? Who do I need to protect? Do I need to protect myself? Are my children vaccinated? Or do I have people in my household who are immunocompromised or who are at great risk? Just because you can do something doesn't mean you should do something. And so people are going to have to really start thinking about their individual risk and how they're going to behave.
Dr. Fauci alluded to it in the clip we heard just there. This has been and continues to be a divisive topic, perhaps in America more so than other countries. How do you balance the kind of personal and political opinions versus state opinions versus federal opinions versus public health demands?
Well, I think we're getting to a point where we're not going to be able to have a blanket rule nationally, and we're going to see cases, vaccination rates, local immunity different in different places, and so we're going to have rules that make sense for different places. For example, we see cases really trending down quickly in some places in the Northeast, in the West. But there are other places that are still experiencing very high rates of transmission. So I think we're going to have to move to a point where we're going to see a lot of local guidelines in place. And there's no perfect answer here because, of course, nothing is happening in a vacuum. You don't have this pandemic happening just alone. We have all of these other issues: mental health, the economy, all of these things together. So it's going to have to be a combination of things. And once we have access to testing and all of these therapeutics that can make a COVID infection be much less dangerous, we're going to be in a better place.
We'll have to leave it there. Professor Anne Rimoin from UCLA, thanks very much for being